Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Dermatologics. I'm Stephanie Talea, Senior Managing Editor of Practical Dermatology magazine. Dupixent performed well in a Phase 3 trial of inadequately controlled moderate to severe atopic dermatitis in adolescents, Regeneron and Sanofi report. In the trial, treatment with Dupixent as monotherapy significantly improved measures of overall disease severity, skin clearing, itching, and certain health-related quality of life measures. In 2016, the FDA granted breakthrough therapy designation for Dupixent for the treatment of moderate to severe for ages 12 to 17 years of age and severe for 6 months to 11 years of age atopic dermatitis. Patients treated with Dupixent had significant improvement in disease severity at 16 weeks. The primary endpoints were the proportion of patients achieving investigators' global assessment score of 0, clear, or 1, almost clear, and 75% improvement in eczema area and severity index at 16 weeks. Moreover, Dupixent's safety profile was consistent with that seen in adults. Detailed results from this trial will be presented at a future medical meeting. These data will be submitted to regulatory authorities later this year. The FDA did not approve DWP-450, Evolus Incorporated's rival product Allergan PLC's Botox, due to chemistry and manufacturing issues. As a result, the company pushed its estimate for the launch of the drug to the spring of next year. U.S. military personnel are more likely to develop skin cancer than the general population, according to a review of 9 published studies in the Journal of the American Academy of Dermatology. The findings apply to both active duty service members and veterans. The military's demographics include 2 groups known to have high rates of skin cancer: Caucasians and men over 50. Additionally, military personnel are often exposed to high levels of ultraviolet radiation, which can increase one's risk for both melanoma and non-melanoma skin cancer. From the Pacific Theater in World War II to more recent campaigns in Iraq and Afghanistan, U.S. military members have been deployed to areas where they face prolonged exposure to the sun's harmful rays, says dermatologist Dr. Jennifer G. Powers, one of the authors of the JAD article. This exposure is even more intense for those serving in desert environments because the sun's rays reflect off of sand. The risk of skin cancer among military personnel is further compounded because sun protection is not a priority among active duty service members. And for many soldiers, skin cancer prevention strategies, like wearing protective clothing that is not part of their uniform or carrying and applying sunscreen, are simply not feasible during deployment. U.S. military personnel face a unique set of skin cancer risk factors, says Dr. Oliver J. Wisco in an accompanying editorial. While they may not be able to take steps to reduce their risk during their deployment, they can take steps to detect skin cancer early, when it's most treatable. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Dermatologics.